Okay, so we always love to do a test your knowledge question. So the question is, when are you required to wash hands? A, upon arrival for the day. B, coming in from outdoors. Before and after using the sensory table. D, when caregivers move from caring from one classroom of children to another. Or E, all of the above. Go ahead and put your answer in the chat or put yourself off mute. Yep. Thank you. I think it's unequivocally E, all of the above. And the reason I say that is because so often we all think that's obvious. However, so many infections could be prevented from spreading if we just washed our hands. And we've been noticing too with some of the inspections that we've done, when people have sensory tables, they're always having the children wash their hands after using the sensory table, but not before. So just it's really important that, yes, hand washing is required before and after sensory play. And our next question, Sining will take away in communicable diseases.
Thanks, Martha. So this question will give you a little clue as to what we'll be talking about later, but I wanted to see if anyone knew how many norovirus particles can cause infection. So is it A, less than 20, B, 100, C, 1,000, or D, 2,000?
Probably 2,000.
Less than 20.
Yeah, awesome. I see a lot of answers coming in, and we will talk about this later, but it is A, less than 20.
And you've now met myself, Martha, and Sining. And whenever you email the health ECE at bouldercounty.gov inbox, we are the people that answer your questions. Sining and I have put together a survey to help us and to help you report illnesses quicker. And so there's a link there on this form. And this form, it'll take you about 3 minutes to fill out. We've been noticing when people have outbreaks or all of a sudden there's a larger number of kids coughing or having fevers or throwing up or vomiting, it sometimes takes 3 or 4 emails for Sining and I to get a full picture of your facility, because we're curious, are you a facility with 20 children and 10 of them are ill with respiratory illness, or are you a facility with 150 children and 10 of them are ill with similar symptoms? So our goal is just to improve the opportunity for us to help all of you quicker. I think at the moment we have about 8 to 10 outbreaks, and so we're just quickly trying to help you as quickly as possible. So if you find that all of a sudden there's a greater number of kids with similar symptoms and you think this might be an outbreak, please fill out this form. It'll just take 2 to 3 minutes. And on this form, it's answers that you would have off the top of your head, such as number of children enrolled in your facility, number of classrooms, number of ill children, number of staff, and if any children are hospitalized or not. So we're hoping this will make us more efficient and be able to help more of you quicker with guidance. And Sining just put the link in the chat. Okay, so just a little overview of what we'll talk about today, just general updates. We have a special guest presenter today, Emily Darrell, she'll share information about how you can apply for the Survive and Thrive grant. I'll do some quick inspection tips. You already had a peek at that with hand washing. Kyla Perlman is on, and she will be answering some food safety tips. We'll talk about the vaccine of the quarter. And then Sining will talk about neurovirus, and then we'll have some partner updates from ECE BC, and then CCAP, which has a new name, the Colorado Food Program. Okay, so put your seatbelts on. Okay, Emily, you'd like to pop on? Oh, thank you, Emily.
Hi.
And I'll let you introduce yourself, but thank you so much for coming.
Sounds great. Thank you so much for having me. Good morning, everyone. My name's, or I guess good afternoon now, right? The day's flown by. I'm Emily Darrell. I work for Boulder County Department of Human Services, and I'm the program manager for several of our programs that are ARPA funded, including our Nurturing Futures Direct Cash Assistance Program and the Survive and Thrive Grant Program, which is what I'm here to talk to you all about today. And I'm just really glad to you all for having me. I did want to check, Martha, should I go through slides? Do you have my slides? What's best?
I have your slides, so I'll
Okay.
just advance it. Is that okay?
Perfect. Yep. I'll just say next slide then. So I've already introduced myself, but I'm here today to talk to you a little bit about the program's background for Survive and Thrive, who's eligible, a little bit about our program timeline, and then hopefully we'll provide answers to some common questions we've been receiving with time for questions at the end. I am not great at monitoring a chat when I'm speaking, so if you do have questions, feel free to put them in the chat, but just know that I'll have to get to those at the end of the presentation that I'm giving. So without further ado, we can go to program background. So the Survive and Thrive program, which in Spanish is Progresando Juntos, is a one-time grant program that's going to provide funding for eligible nonprofits and childcare providers. Many folks who are here today fall into one or both of those categories. Funding amounts are going to range from $5,000 to $150,000, which we know is a huge range, but it depends on the type of provider that's applying for this funding. So I'll share more on that in a moment. And funding for this program comes from our ARPA or American Rescue Plan Act funds. And so that means it aims to alleviate some disproportionate impacts from COVID-19 pandemic. In this case, it's aiming to relieve economic strain experienced by nonprofits and childcare providers, which we know is disproportionate compared to other sectors. We also want to share that we did partner with an organization called AidKit to help design this program and this program's application, just to make sure everything runs smoothly. And AidKit has a history of helping government organizations with implementation of similar aid programs, thus their name. We did work with them for our Nurturing Futures program too. So they're going to be providing some technical assistance with application once it goes live. That's why we mentioned that here. So next I'll talk about the eligibility requirements, which is on the next slide, I believe.
Oh, sorry.
Yes, awesome. No problem.
Okay.
All right, there we go. Since this program is linked to our ARPA pandemic recovery funds, like I mentioned, there are certain eligibility criteria that apply, and most of them are listed here, but there's a few additional ones. To be eligible for funding, all applicants have to be located in and providing services in Boulder County. They have to have provided services in 2020 and or 2021. That's so that we know that this is a pandemic recovery program. So that's pretty important to have been in operation during at least one of those years. The applicant has to be at least 18 years of age or older, and the organization has to have experienced at least one negative impact as a result of COVID-19 with lasting effects today. And we do provide a detailed list of what those economic impacts entail on our program webpage. There's also a few additional requirements by applicant group. So this program funds two types of childcare providers, both licensed childcare providers and unlicensed family, friend, and neighbor providers. And both groups have to serve children ages 0 to 5 in order to qualify. So for licensed providers, that means that you must be licensed to serve children ages 0 to 5 in order to qualify. And then for nonprofit organizations, nonprofits must be licensed as either a 501c3 or 501c19 organization, and they have to provide safety net services. We also provide a detailed list of acceptable safety net services. You just have to provide at least one of those services. Thank you. Now I'm ready for the next slide. It's a lot to cram into a presentation. I appreciate your managing the slides for me.
Anywhere from 5,000 to 100,000 that you could get.
Yes, so, and before I talk about the exact funding amounts, I just want to say, we want to make sure you know that if you are a licensed childcare provider that's also a nonprofit organization, you can apply twice. There will be two different applications. One application if you're childcare, one if you're a nonprofit. We recognize that folks fall into both buckets, so you can apply twice. There is that option. However, being accepted or receiving one type of funding does not necessarily guarantee the other type of funding. So funding provided through this program, as I mentioned, varies depend on the type of provider who's applying. So eligible family, friend, and neighbor providers can receive a grant of $5,000. So that's the $5,000 amount. Eligible licensed childcare providers can receive anywhere from $8,000 up to $40,000, and that depends on the number of children that you're licensed to serve. So serving more children means potentially receiving additional money. And these funding amounts for licensed providers and nonprofits are guidelines. So the funding amounts may be more or less depending on a few different factors. Then eligible nonprofit organizations can qualify for anywhere from $50,000 up to $150,000. And just want to make sure folks know the funding has to be used to address negative impacts from the pandemic. And we do know that those negative effects are pretty broad and pretty long lasting and just very diverse depending on who you are, what your organization experienced. Right now, there is no reporting requirement once these funds are awarded, but we do expect that licensed childcare providers and nonprofits will maintain their records for the spending of this money just in case something changes. And that's just recommended best practice in any instance where you're receiving funding in these types of amounts. But right now, there's no reporting requirement. And then a last note, family, friend, and neighbor recipients can choose how to receive the money. So we have the option of a direct deposit into a bank account, or we can mail debit cards for that amount, just recognizing that family, friend, and neighbors may be unbanked or underbanked. So we have that option available. And then next we'll chat about the program timeline. Again, this is an estimate, but right now we are aiming for an application launch of February 24th. That's several weeks from now on a Monday. Our hope is that we'll be posting a link to the online application on our webpage on that date. We'll have several weeks where the application is open. It's not on a first come, first serve basis, but you do have to apply within that application window in order to be considered for funding. After this, we're going to review applications throughout the month of April with an estimated time for payments going out at some point in May 2025. Again, this timeline is slightly subject to change, but we want folks to know sort of what they can expect as far as the application opening and then reviewing and funding going out. And then I know that I have a very short time with you all today, so I want to share details for 2 additional info sessions we're hosting for the community about this program. We're going to have 2 Zoom sessions coming up in February, so anyone who's interested can attend and learn more and ask questions. It's going to be a Zoom webinar format, so folks can join and just ask questions anonymously if they wish, or just join and watch the show and learn more that way. The first session is just an hour long, February 19th at 10 a.m. And the second session is an hour and a half. That's on Monday, February 24th. And it's a little bit longer because we're hoping to do an application walkthrough with our partner aid kit so that folks can see what they'll be expected to answer, what they'll be expected to provide at that time. So I'll put the info for that in the chat as soon as I stop talking in just a second, but we just want folks to know that these are coming, spread the word, and feel free to join us for these sessions. It's open to anyone who's interested. All right, and then I think that that's all I had today, and I am ready to address some questions. Let me just put some of this info in the chat. We do ask that you register for those info sessions, and I put links in the chat there. To be clear, so I'll read questions I see in the chat. License has to be for 0 to 5. What if our license is for 2.5 to 6 and we do not see infants or toddlers? So we do ask, I guess, so your license is for 2.5 to 6 years, but you're not serving. Like, what age group are you serving, actually? If you're comfortable responding to that question. If not, I can follow up with this group and send a more detailed answer. We do, as far as my understanding, the intent of this program is to serve child cares that are licensed, that are serving children ages 0 to 5. So if you're serving children who are 2.5 to 6, then my understanding is that you still are serving children within that age group and you would qualify, but I will double check on that and provide an official statement following this meeting. So 6. That's a great question. Thank you. And that's part of why I'm here too. And what will we need to prepare for the application? So we ask that folks who are applying have knowledge of the economic impacts that were experienced as a result of the pandemic. So you'll want to be someone who knows the ins and outs of your organization's finances in the past. We'll be able to speak to any staffing struggles you experienced, any trouble meeting your expenses, that sort of thing. You'll be asked to provide information about your license, and additional information is going to be shared in the info sessions. I don't have a ton more info to provide right now, but we do ask that you have information ready to go about just what impact you experienced. It would be good to know about any other ARPA funds your organization has received as well. And actually, I can share additional information. So our application and payment provider aid kit also collects information in order to mitigate the impact of fraud that happens with online applications. So you'll likely need to provide your ID and a selfie in order to complete the application. And that's so that we can verify that you are who you are. You're a real human. You're not a bot that's applying on behalf of Fairview Montessori or another organization. So having some form of ID and being ready, equipped with a webcam is recommended. And so we would provide negative economic impacts during 2020 and 2021 only. So the requirements for the program are to have experienced negative economic impacts as a result of the pandemic. So the negative economic impact doesn't necessarily have to have been within those 2 years. You do, however, have to have been in operation during those 2 years. And we do want evidence, we would like support that you are continuing to experience those negative impacts. I will say from my understanding of the application right now, this is we've designed an application in such a way to make this very easy and very accessible. Our hope is that everybody who applies in the childcare side of this will receive funding because we know childcares were extremely disproportionately impacted. So when I say please be ready to speak to the economic impact that you experienced, this might be providing us with a narrative response of the negative economic impact experience. It could also include upload a receipt for money that you spent on masks or other things like that, or details about struggles with staff. I think it's a pretty broad term, and the application, again, it's designed to be super accessible for those who might want to apply. Okay, so if we have grant specialists in our company, can we have them on the call for us? You mean at one of the info sessions that I shared? I think we welcome anyone to attend those info sessions. If you have a grant specialist, I think that's great. And having them attend the info session and know what questions they'd like to ask seems like it would be really beneficial. That's definitely an option.
Hey, Emily, this is Jane. I'm
Yeah.
wondering, I know there's a lot of probably more questions percolating, and I'm wondering if we could hold some of those for your information session. And isn't
Totally.
The Early Childhood Council also holding some time for people to gather, and they're holding some support time for this grant as well?
Yes,
And
I
then,
think that sounds great. I just looked at the time. That makes perfect sense.
I'm so
Y'all have
sorry
a full
because I
agenda.
know there's tons of questions, and I respect that. I just don't want to. I want to
Yep.
give them the time that you need. So Emily, it's been awesome to have you here, and it's awesome that we have this funding. But I know Martha has and Sinine have a pretty packed agenda, and there is some other support time. So I'll just
Yes.
ask if we can hold that. Thank you.
Absolutely.
you.
That sounds great. And I put my email in the chat if folks would like to email me questions in the meantime. So thank you all for having me. and I appreciate your time. Send me a question. Join us at our info sessions.
Thank you so much, Emily. What a wonderful opportunity. And the fact that it's opening February 24th, the application, and then they will already receive the funds in May. That's an incredibly fast turnaround time. So super exciting. So please reach out to Emily. Thank you, Emily. And her contact info is in the chat as well. Okay, so the next part, we're going to jump to inspections, and we at Boulder County Public Health want to partner with you for success. We want to help you put that last puzzle piece in so you're successful. And last, CDPHE has a child care facilities guide to a successful inspection. We've talked about that, I think, the last 3 quarterly meetings. And each time I choose a different topic. Last time it was sanitizers, and this time it is hand washing. And when we as inspectors come in, we want to make sure that we see that sinks are stocked with soap and paper towels are accessible to children. We want to make sure that the sinks are accessible to children and that hands are washed at the required times, which we talked about at the beginning, before and after sensory play, and that water in the sinks are maintained between 90 and 120 degrees Fahrenheit. We don't want it so cold that children don't want to wash their hands, and we don't want it too hot, higher than 120, that they feel like, or you feel that they might scald their hands. That being said, there are new health regulations coming out. CDPHE has been working on these for over the last year. And one of few changes are the temperature of water in the hand washing sink can be between 85 to 120 degrees, not 90 to 125, but 85 to 120. And then one of the other big changes is that the health report will be formatted differently. So after an inspection, we usually send out the bill and the health report. And just so you know, the report will come in a different format. And there'll be a lot of trainings on these. We haven't even been trained yet. And so this won't really be coming out until April or so. But just wanted to make you aware, new health regulations are coming out. Now I'd like to introduce Kyla Perlman. So many of you probably know Kyla because she's taught healthy eating, active living with Tori, another one of our child health promotion specialists. And Kyla will be putting on a new hat. Not sure if Kyla's here today.
I am. I was here late.
Oh, no worries. But Kyla,
I just logged in and here's my hat.
Oh, super. So many of you probably have read The 500 Hats by Dr. Zeus. Well, Kyla is one of, as many of you know, Kara Kaiser is retiring, coming up soon. And so Kyla and I will be helping with inspections as well as Jane. And Kyla has been with Boulder County Public Health for 19 years and has had 3 years of focusing on food safety with restaurant inspections. So I asked her up front, what does she think are 3 top tips that ECE directors could use to help prevent foodborne illness in their childcare facilities? Take it away, Kyla.
Thanks, Martha. So it's nice to see you all, and I will be seeing you out in the field from time to time, which is really exciting to get to see people in person and check out your facilities and say hi to the kiddos and everything. So as someone who's coming with a food safety background, I like to look at your kitchens and see how things are going in there. Martha asked for 3 top tips, and my top tips are hand washing, which I think Martha has already gone over in great detail today. Yes, Martha, I missed the beginning of this, but I know that was the plan. So just like we talk about hand washing in the classrooms, it's really important in food safety, food service as well, to make sure that you have that separate hand wash sink, that it's only being used for hand washing, that whoever's preparing the food knows when and how to wash their hands appropriately. The other thing, which is also Martha and Seaning's bread and butter, is illness. So if you have someone who's preparing food who's been ill or who is currently ill, that can really cause a lot of problems in your facility. So just like you have illness policies for your classroom teachers and everyone else who works in your facility, it's extra super important to make sure that folks who are handling food are following those illness policies as well. And then the third thing is just what I've been seeing now that I've been out in some childcare programs and looking in their kitchens is the temperatures in your refrigerators. So all potentially hazardous food needs to be 41 degrees or lower. So it's important to make sure that your refrigerators are functioning properly, that they have a thermometer in them, either on the inside, that you are checking regularly at least once a day. You should be checking to make sure that the thermometer is reading 41 degrees or lower. If it's not, then you need to make some changes. Maybe that's you need to just adjust the temperature settings on your refrigerator. Maybe it's a maintenance problem and you need to call someone in to fix the refrigerator. And maybe you just need to move food. And if you have food out of temperature for very long, then you need to move that to another refrigerator or come up with some other backup plan if your refrigerator isn't functioning properly to make sure that your potentially hazardous food stays nice and cold. I think you've seen this before. We like for people to use a refrigerator temperature log. It is not required, but it really is best practice to make sure that you're keeping that someone is watching the temperatures, that you're taking corrective action if ever the temperatures are not correct, because we don't want to have to walk in right before lunchtime and throw out all your food. That would be a bummer for everyone. So it's really in your best interest to keep a temperature log where you're checking at least once a day and writing that corrective action in.
Okay, thank you so much, Kyla, and
thank you, Martha.
Thank you for putting on another hat.
And I'll just put out just a tiny little plug. Martha and I are working on creating a food safety training specifically for childcare programs, because the retail food safety training is quite a bit more than you really need to know. But that is something that's coming up. So if anyone has interest in a training specifically around food safety practices, Martha and I would be happy to help you out. Thank you.
Yeah, welcome. Thank you, Kyla. Okay, now we're going to jump gears to vaccines. So each quarter, we're starting to feature a certain vaccine. And so this quarter, we are going to focus on varicella, which is the same as chickenpox. And you can see the two columns here, on the left in pink, on the right in blue. And in the pink was the number of cases of chickenpox before the U.S. varicella vaccination program. So you can see 4 million cases, 10,000 hospitalizations, and up to 150 deaths. Since the vaccine program, there's fewer than 150,000 cases, fewer than 1,400 hospitalizations, and less than 30 deaths. So the vaccine program has reduced varicella cases by 97% since 1995. And who benefits from the varicella vaccine? So those people that are likely to have severe outcomes. So that would be pregnant people, newborns, people who are severely immunocompromised, such as people with cancer or other immunocompromising diseases, diabetes, premature infants. And the vaccine can also help decrease the risk of shingles. I love this little baby in the middle, those big bright eyes. And the benefits of the varicella vaccine. So it's the best tool that we currently have to prevent chickenpox. And again, a person might still get chickenpox, but our goal with any vaccine is to take it from a lion to a kitty cat. So to take it from wild to mild. And this is for any vaccine. I want to play a 2-minute video here about herd immunity. And it talks about the importance of vaccines with, can you hear it okay?
No, we don't have volume.
No.
Okay.
Martha, I think you'll have to unshare and then reshare.
Okay, because I
with
thought I
sound.
added sound, but I will
Oh, maybe
do
it's
it
just
again.
not loud enough then.
Okay, include sound. I'll share again. Thank you so much.
Protection when most people in your community are also vaccinated because it
Can you
prevents
hear it now?
outbreaks from actually happening. That additional protection not only helps you and your family, but it also helps people who are too young to be vaccinated, people who can't get vaccinated because of certain diseases, and those whose immunity has actually worn off. I like to use an analogy when I explain community immunity. Think of germs like the rain. When you get vaccinated, you're actually putting on a raincoat to protect yourself. But the best way to protect yourself is to have an umbrella and a raincoat. You can't get that umbrella by yourself though. The entire community has to come together to buy that umbrella. And the way they do that is by vaccinating themselves. And that provides best protection for everybody. Not only does it protect you, but it also protects people who can't get vaccinated and can't wear that raincoat. And that's children who are too young to be vaccinated, people who have certain diseases who can't be vaccinated, and those whose immunity has worn off. When 90 to 95% of your community is vaccinated, it keeps outbreaks like measles from happening. We know this because we've seen it happen. So the best way to protect you and your family is to get vaccinated, but make sure that your neighbors and classmates do the same.
Oopsie. Okay, well, I like that video about the analogy with the raincoat and the umbrella. Okay, we're going to jump over to communicable disease update with Xining. Take it away,
Awesome.
Xining.
Thanks, Martha. Hi, everyone. Again, just to reintroduce myself, my name is Xining Chan. I am one of the epidemiologists with Boulder County Public Health, but I'll be going over some norovirus updates today. And I know that you all have been seeing a lot of respiratory illness in your facilities. But we did do an update on respiratory illness last ECE partner update. So if you want to review those slides and if you have any questions about respiratory illness, of course, you can always reach out to us. But today we'll be talking about norovirus. Thanks so much, Martha. Next slide. So just in background on norovirus, I'm sure many of you are very familiar with it. But it is often known in the community or in the general public as the stomach flu. Typically, the incubation period, so the amount of time between when you're exposed to norovirus and when you develop symptoms, is about 24 to 48 hours. And it only lasts around 1 to 3 days. And really, it's closer to that 24 to 48 hour period as well. The different ways that it can be transmitted are through food, from person to person, and through direct contact with someone who might be ill with norovirus. So, as some of you might be asking, what makes norovirus so infectious? So why do we care about it so much here at Public Health? Well, the first thing is that it has a really low infectious dose, which we had talked about at the beginning of this presentation. So it takes less than 20 viral particles for someone to get sick from norovirus. That's really, really low. Typically, other pathogens take more than 1,000, and it really just depends, but 20 viral particles, if you think of the size of a virus, is not a lot at all. It's quite hardy in the environment, so it's really hard to kill. It's difficult to disinfect, and most common cleaners are not effective against norovirus. It can live on surfaces for up to weeks if it's not cleaned correctly or disinfected correctly. And then the last thing is that hand sanitizer is not effective against norovirus at all. And then finally, vomit particles can travel over 10 feet. So if we're thinking about in COVID times, we were worried about 6 feet of distancing. With vomit, we were worried about 10 feet. So that's quite a large amount of area if you're thinking about it in the classroom, if someone's vomiting in the classroom, or even in the bathroom, in a shared bathroom. It can act like airborne transmission in these cases because of the way that it travels. And so, like I had mentioned on the previous slide, it is really hard to clean and disinfect for norovirus. So it's really important for you all in the classroom to make sure you're doing it correctly. We should be cleaning and sanitizing food contact surfaces, anything that's highly touched has a lot of contact. So, any counters, tables, doorknobs, stuff like that should all be disinfected properly when you have any suspicion that there's norovirus in your facility. You should especially be focusing on high touch areas, like I said, doorknobs, chairs, I'm trying to think, toys, stuff like that. You can also, for anything that goes in the laundry, as long as you're using it on the proper settings and using it with heat in the dryer setting, it should kill norovirus as well. There are EPA registered disinfectants, as I'm sure you all know, and Martha had mentioned new requirements or regulations coming out recently, and so there will be some changes to that, but we can talk about those more when they come out. But there are specific registered disinfectants that are effective against norovirus, and if they're not available, you can always use a bleach solution, which we're happy to walk you through if that happens in your facility. Kind of carrying on with cleaning and disinfecting. So when you are using those EPA registered agents, please make sure to check those instructions and directions and pay attention to that contact time. If a surface isn't kept wet for that whole contact time, it is quite less effective against killing norovirus. So we want to make sure that during the duration of that contact time, so some cleaners it's 5 minutes, some it's 10, really we want to make sure that it's staying wet through that whole time. Like I had mentioned earlier, anything that goes in the laundry can be laundered in hot water to be effective against norovirus. And then washing hands as always, making sure you're using proper techniques, warm water, soap, making sure you're scrubbing for at least 20 to 30 seconds can be really, really effective against preventing norovirus. And then this is probably more what you are all curious about, because I'm sure you have dealt with norovirus mitigation and prevention several times. But what constitutes an outbreak in terms of public health, right? I think that we all know that when we see norovirus, it is likely already going to be more than 2 individuals. It's quite obvious whenever you see an outbreak of norovirus because it will spread very, very quickly, and it doesn't leave many people unscathed. So what constitutes an outbreak? So when we're looking at outbreaks, we're looking at an increase in the number of cases. So anything above baseline, right? So if we're looking at a classroom, if typically there are individuals that are out with the nausea, vomiting, or stomach issues, we want to look at anything that's above that, because I know that some kiddos do have problems with GI, GI tract issues, or they just tend to vomit more than others do. And then the other thing that we're looking at as well is if there's any similar illness in 2 or more people from different households after consuming the same food item. So really that outbreak definition applies more to like restaurants or other places where, there's retail food establishments or something like that. But that can apply to your ECE as well if you are serving food. And then I just want to go over some outbreak mitigation practices in the case that you are in an outbreak for norovirus or GI illness. I realize that I'm talking about norovirus, like the diagnosis of norovirus throughout these slides quite a bit, but I think that we all know that norovirus often goes undiagnosed. So really what we're talking about when we're looking at these outbreak mitigation practices is just if we're seeing a large increase in GI illness, especially among individuals that have contact with each other, right? Like if you're having GI illness in 5 different classrooms and they don't overlap, probably not, so I should explain more, sorry. An individual case of GI illness in 5 different classrooms might not trigger an outbreak response, but if you're having 5 cases of GI illness in 1 classroom, that might trigger an outbreak response. And that is something that we can talk about as well. If you guys have any questions about that, always reach out to that health ECE at bouldercounty.gov email. But in the case that you do have an outbreak or a cluster of GI illness in your facility, we always recommend to post signage reminding individuals to wash hands with soap and water. You can also notify parents of any disease activity or symptom increases of certain symptoms in your facility. We always recommend including ill individuals, even without a diagnosis. With GI illness specifically, it's 24 hours after symptom resolution. If we are seeing an outbreak of GI illness, we typically raise that to 48 hours after symptom resolution. You can always go ahead and cohort your students. Group activities between classrooms should be halted, and that we don't recommend allowing for floating of staff members. So we want to make sure that staff members are staying in contact with a certain group of kids, because if they are floating from classroom to classroom, obviously that increases the risk of transmission from classroom to classroom as well. Staff should always wear gloves and masks while cleaning feces or vomit. That masking is important because, like I had mentioned earlier, when kiddos vomit or when anyone vomits, it can travel up to 10 feet. So it can act as sort of like an airborne transmission. And then increasing cleaning of high-touch surfaces, which we had mentioned previously, and then making sure you're disposing of any food prepared by ill individuals. And then this is important for your facilities specifically, but ensuring that no outside shoes are being allowed into the infant rooms. And I think that's all my slides. If anyone has any questions, feel free to drop them in the chat, or you can always send us an email later. Thanks.
Sorry about that. I forgot to put my mic on. So thank you so much, Sining. If you have any questions about norovirus, please put it in the chat or feel free to unmute yourself. But here on this slide, I just wanted to advertise some of the free classes that we have for childcare providers. These are all the healthy eating, active living classes. And contact Kyla, her other hat, if you're interested in any of these HEAL classes. Our next Health ECE partner meeting is in May. So it's the second Monday in May, May 12th from 12 to 1. So if you have any topics you'd like for Sining and I to discuss, or any guest speakers you'd like for us to bring in, please email me at the healthece@bouldercounty.gov email address. Now we'd like some updates from our partners if they'd like to give them. So first of all, our Early Childhood Council of Boulder County, ECCBC.
Hi, thank you. My name is Sherry Hannah Bennett, and Amy couldn't be here today, so I'm happy to provide some updates. First, I wanted to clarify, Jane had mentioned that the council is going to be hosting some question and answers for the Survive and Thrive, and actually she hasn't solidified that with Emily, so more to come on that. But we do have a Rooted in Care program that is for our family, friend, and neighbor providers, and it's professional development opportunities along with quality improvement materials for 3 different cohorts of 20 that we are going to be running, and I will put that link in the chat. It's called Rooted in Care. And then we also have our next touch point course coming up, and that'll start on March 7th, and we hope that you guys can enroll in that.
Okay, thank you so much, Sherry. Does anyone have any questions for Sherry? Okay. And now I see that Jody Sherman is on. She's going to share with us about any updates with the CCAP program,
Yeah,
the Child Care Assistant Program.
Yeah, a little confusing because we did not change our name. We are not the Colorado Food Program. That's that's something else. That's okay. However, I'm happy to be here with you all. I think what's on a lot of people's minds, and I just wanted to kind of share some information from our human services leadership. about the federal funding freeze. Just so that everybody's aware, obviously things change quickly. However, the Boulder County Human Services leadership team is monitoring very closely all the changes and keeping us, the staff, updated, and we in turn will keep you updated. And at this time, thankfully, aside from a few federal grants, we are not hearing that the potential federal funding freeze will directly affect any of our programs. Again, you know, CCAP is on freeze, kind of related and unrelated. I don't think the federal freeze will help our freeze, but they're kind of two separate things. So I want to kind of throw that out there. And then also the initial phase of implementation of the House Bill 241223 and the CCDF, which is the federal block grant, that fund CCAP, the requirements for both of those things are leading to some rule changes from state CCAP. And none of the ones that we're really looking forward to are being implemented right now, like the pay in advance and pay weekly in advance for services that we so appreciate that you provide to our kiddos. However, there are a few minor things like an adjusted eligibility period when a child is added to a case, standardizing post-secondary education as an eligible activity. That's statewide. It's always been true for Boulder County. And then extending the current parent fee formula through July 31st of 2026. So things will keep developing, and I know that our state partners are working on rules to continue this implementation throughout 2025 to hit the 2026 deadlines to implement all of these great changes that are coming. That is all I have.
Okay. Thank you so much, Jody, and I'll change these slides before we send them out. I apologize. Okay, just as we wrap things up here, if any of you on the call would like to receive a professional development certificate to put in your PDIS, you can email us with your first name, last name, and facility name to healthece@bouldercounty.gov. And in the next week or so, hopefully this week, I'll have those professional development certificates ready to mail out to you. And then if there are any other topics that you would like Ning and I, like I mentioned earlier, for our meeting, our next quarterly meeting, please email us as well. And then just to end, thank you so much for working with Boulder County Public Health with our common goal. I think we all want to prevent the spread of disease, to keep our classrooms open, and to provide healthy spaces for children and teachers to learn and thrive. So again, thank you so much for everything that you do. And I don't have any extras. Okay.
Martha, there is one question in the chat from Mary Mann.
Thank you.
About reusing shoe covers and the sticky mats outside of the infant room.
Question about so
if you have a thought on that. Reusing, I believe most programs are not reusing shoe covers.
That's what I've seen as well.
And the sticky mats outside the classroom. I mean, I think that's fine. I don't know anything about those.
Mary, could you share a little bit more the sticky mats outside the infant room?
Yeah, some of my centers are reusing the shoe covers, which to me just defeats the purpose of the whole thing. But they're trying to figure out like how to, they take their shoes off outside of the room, but they're standing in the hallway in their socks and it's dirty out there. And then they enter the room. Do you see what I'm saying?
Mm-hmm.
So some of my centers have shoes. They have, just separate slippers that they keep at the center, and that's the only thing they wear in the infant room. But I'm talking more about visitors that come. One of my centers actually has this sticky mat that they got on Amazon, and it doesn't, obviously remove everything, but they take their shoes off and then they stand on the sticky mat with their socks, and it's supposed to remove any debris or anything, and then they go in. So I was just wondering what your thoughts are on that, or if you know anything about those.
I'm not familiar with the sticky mats.
Okay.
I think my biggest concern is what's preventing the spread of illness from one person standing on the mat to the next person standing on the mat. So I don't necessarily see that as an advantage.
Yeah, I'm just trying to understand what the best thing would be. I mean, obviously new shoe covers each time, but that gets expensive. So I'm just wondering what your thoughts are on it. But you can just send it to me, Martha. No big deal.
That's a great question.
Yeah, if you just want to send me whatever you think.
I think I
Thanks.
have to do some research with that and talk to CDPHE because it sounds like the sticky mats, that might be a new product out there.
I'll
My
send
gut
you a
feeling
picture.
is I can't see how it would prevent the spread of disease.
Yeah. I don't know. I think it's more for like dirt and stuff, but I'll send you a picture of what it looks like. Tell me what you think.
Because if it sticks, if the bacteria sticks, then it's going to stay there longer. And they're probably not, the cleaning crew isn't cleaning the mat. So.
Right. Well, you take off that sheet and there's another sheet underneath it after the day or twice throughout the day. So I don't know.
Okay. Yeah. Send me a link to the product.
Okay.
Thank you.
Awesome. Thank you.
Okay. Does anybody else have any more questions? Oh, could you have socks you wash between use? Beth asks. So would those be fresh socks every time, Beth? Yes. I think if you had fresh socks and you made sure, like some people use one-time use cloths to clean tables, if you had fresh socks every time, but that could mean one of the workers needs to bring, one of the childcare staff members need to bring 3 or 4 socks every time they come and go from the infant room. So something to think about to see how practical that would be, Beth, for your staff. But great question. Any other questions, concerns, or comments? Okay, well, thank you so much, everyone, for coming. And I think Sining and I will stay on a little bit, but have a good rest of your day. I don't know if you want to stop the recording, Jane.
I'm working on it.
Oh, no problem. Hi, Kyla. Do you have a question?
Stop is.
You know what? I think you need to
There it is.
unmic.
Got it.
Unmic, Kyla.
I have a question about